I'm Estoril for the ESH conference on AML. So the question today is what's the risk of developing AML for the women who are diagnosed with breast cancer? So this risk, which is of course a concern for these patients, is known for many years. We recently published the results of a large study which was conducted in France. We took the opportunity with our colleagues from the ANSM, the group of the pharmacoepidemiology of Marseille, to look at a very large nationwide database. This database was made available very recently. So what's interesting is that this database contains all health-related expenses of all French residents, so that's 60 million people. So Marie-Joëlle Jabagiji, who did the job, identified 450,000 women diagnosed with breast cancer between 2009 and 2016, and with a median follow-up of 5 years. She identified 3,500 cases of haematologic malignancies that were developed in these patients. Among them, AML and MES were the most frequently observed secondary malignancies, hematologic malignancies. So this is a confirmation of what was already known, but it's confirmed in a recent and large cohort of patients. What we also seen is that the standardized incidence ratio for MDS and AML were comprised between 3 and 5. So that's important. And in the second study, we looked in more details on the risk of developing AML and MDS according to the treatment modalities received by these patients. And as expected, we confirmed that the combined modality, that is radiation therapy plus chemotherapy, was associated with the highest risk. So in conclusion, for us, this study is a first step for setting up a surveillance of this risk. It is important because cancer patients hopefully are living longer. Most of them are cured, so we have to be careful regarding the risk of secondary hematologic malignancies. We are changing the treatment modalities. Some of them may reduce the use of chemotherapy and radiation therapy, and thus may reduce the risk of secondary AML or MDS, but other modalities could lead to DNA damage, for example, and increase that risk. So we have to be very careful with that. And this, combined with recent progress in the genetics, which were discussed yesterday morning here in Estoril, increase our ability probably to detect the patients who are at risk for developing such secondary AML or MDS.